My name's Katie. I've just qualified as a nurse on Sidmouth ward, which is gastroenterology. I've literally just got into my blues the last couple of weeks, so it's quite exciting.
I'd just say I'd encourage anyone to come to this trust. It's a really good place to work. I remember a couple of years ago it was voted as one of the best in the country to work for, and I would definitely agree. It's been really good. I trained here as a student nurse, worked here as an HCA before, and through every stage of my career I feel that I've been supported and welcomed, and been to nearly every part of the hospital, and I've never gone anywhere that I wouldn't go back.
When I came here, I was open to many things, I've experienced a new experience. It was a little bit hard in the beginning, but my team, my sister, and we work with some people that can help us, and I think the point is the team that you can trust, and they will help you, and they will be there for you. I think it's the secret, and you need to be, you need to work hard in the beginning, because it's a different language, it's a different place, it's a different way of work. But if you are with an open mind and just try to learn, try to focus and try to catch everything, I think is the secret.
I started as a student nurse and didn't really know what speciality I wanted to go into. And through my various placements, I then had a really good experience down with the CDU team, which is now called AMU. And I had 2 placements there as a student nurse, and then I went back there as a newly qualified nurse.
I mean, it's quite scary now that I'm newly qualified, but the team are just really supportive, and they're always there to help, and the patients are great. You get your bad days, but it's worth it. It's worth it.
You can't get through the day without a good team of people, and we're brilliant wherever we are, whatever ward we're on.
I think the most important thing is because I'm doing what I like to do, and the people in here, they are always with a smile. Sometimes we have bad days, of course, but the conversations, the interactions with the people of different types of working, work clerks, porters, doctors, healthcare assistants, and social workers. Everyone works to a point, and to do the best to the patient, and work with the patient is it's amazing.
The hospital provides a lot of development if you want it, so it's very good. And you always have people around that you can ask, and that they can teach you.
I really enjoy now, that I have taken a step away from kind of a direct clinical area, but bringing the new nurses into the hospital, supporting them into integrating into their areas, getting them up and running with all their mandatory training, the preceptorship programme, but also the kind of helping them with their development after that as well. So like the senior band 5 programme, the band 6 programme. It's really nice to keep that kind of ongoing development going. And I think the trust really recognises that. And if you have to be proactive yourself, but it's nice that the trust see that and want to develop you as an individual.
When I first started here, I had some experience from the previous jobs, and I just carry on with development of my skills and my knowledge, and then at some point that was the opportunity to progress in my career, so I've managed to get this promotion, which makes me very happy.
The shifts I do on my ward, I do 7 till 7:30, or nights I do, again, 7 p.m. till 7:30 a.m. But it's quite good because like this week I'm doing Monday, Tuesday, Wednesday, and I'm not in again till next Tuesday. So it's really good. Okay, I'm in the ward quite a lot the next few days, but it means that you really kind of, your patients, what's going on, and then you have like 5 days off in a row. So it's quite good for social.
I happen to be a father. I have an 11-month old son at home, and I find that the long days actually suit our life a lot better than the short days. So personally, I go in for the 12.5-hour shifts, which mean that I only do 3 days a week rather than doing 5. which means get more time with the family, which is brilliant.
We can now work 7 nights and then have 7 days off after that. So you can add that week to your annual leave and go on holiday. So it's very flexible.
You like looking after people and making a difference in their lives. So in my case, I really wanted to save lives, which is why I went for A&E and the emergency department rather than some of the wards.
I'm very passionate about elderly care. I think people, obviously, they think about you coming to hospital to save lives and make a difference. Well, actually, life towards the end is where I think I make a difference, and that's what's important to me. I think knowing that your final years are full of as much quality as possible is probably equally as important as your early years coming into the world.
I love to help people. I love people. I love to talk. And I like when the patient came sick and you know that you are making a difference and you can give like a little support and being with them, and just sometimes it's just a word that it's enough. Sometimes it's more than that, but you arrive home and you know that you make a difference and you do something. So I'm very proud what I do, really, and I enjoy it every day.